Welcome everybody. This is Kimball Torres here with my guest Ylan, and she will go over a little bit more of herself. But just to let you guys know that we have started this new Excel program. Very excited about it. This is our first episode of our first series based in this in this YouTube channel that we're going to be bringing to you to bring a lot of resources to you guys, educate you guys, but also in a fun environment so where you can see things from a different perspective. It's real people talking to the real community, being in the community. So I'm very excited about bringing you guys this channel. Again, I'm your host, Kimball Torres, part of SCAASF, which is bringing you this, again, Sickle Cell Anemia Awareness, San Francisco. And without further ado, I'm going to introduce my beautiful guest today, Ylan. She'll give you her full name and her little bit of background.
Okay, so my name is Ylan Hunt. I am a community health worker / social worker. So by trade, I am a social worker, and I've worked with sickle cell disease my entire life because I also have sickle cell disease. So this is a very personal journey for me. So I've had to navigate through a lot of the things that I'm here to also help my peers with. So this background as far as education, if you care to know, most recently graduated from UC Berkeley in 2020, May 2020. Prior to that, there was, what else did I do? Forensic, some of everything. Forensic psychology degree, oh goodness, from Argosy University. I also attended Cal State East Bay, right at the name change. It was Cal State Hayward when I started, so that was a while ago. But anyway, my passion has always been in mental health. So my degrees are in psychology, forensic psychology, and social welfare. I think that's enough background.
There you go. Awesome. Welcome, Ylan. So it's Ylan, not Ylan.
Elon. Like Elon Musk.
Like Elon Musk. Got it. With the fancy lettering.
Right.
I like the Y better.
Yes.
It kind of makes it flow a lot easier.
Uh-huh.
So welcome. Great to have you on the show. Again, the first series is going to be based on resources out there for sickle cell patients, the caretakers of sickle cell, advocates for sickle cell, and Ylan, as she's mentioned, is very knowledgeable in these areas. She has a lot of experience in it. So we're going to do some questions to kind of break it down for her. Again, this is going to be broken up into 6 episodes of this series on resources. And again, those episodes will come to you on a weekly basis. It'll either be Wednesday or Tuesday nights, and we'll let you know through email and through the blast outs that we'll send to you guys all. So without further ado, let's get into this. Ylan, what are the different resources available to sickle cell to the sickle cell disease community, like medical, financial, assisted living, etc., within those group ranges?
Okay. So there's actually quite a few resources out there that people don't know about, and it's because the way that they're set up, they're sometimes tricky to navigate. One of the ones that's very common for a lot of people that tend to be more, I don't want to say more sickly, but need more assistance with activities of daily living is the in-home supportive services program. You would have to have Medi-cal to qualify for IHSS, but basically it's a bucket of money where the county pays for someone to come in and assist with things like bathing, grocery shopping, cleaning up the house, getting you to and from medical appointments. There's a whole assessment that the IHSS social worker does in order to get you a certain amount of hours per month that someone can come in and help with things around the house. So IHSS is a gem for a lot of people that aren't as independent as they would like to be. One of the other programs, I think, with medical assistance and just getting medical coverage in general, is Medi-cal, or the Medicaid program. Medi-cal opens up a lot of doors, just like with IHSS, you have to have Medi-cal first. So a lot of the procedures that are common for people with sickle cell disease may not be covered without insurance, or they're very costly without insurance. So for me, I've mostly had employer-sponsored coverage, whether that's under my mother or from my job directly, but there were still things that my coverage didn't pay for. So there would be like a supplement to that health coverage with Medi-cal, or with the other program, GHPP, the Genetic Handicap Persons Program. So that program is also very great. The application process is straightforward. However, I do believe they're understaffed, to be frank about it. So it is time consuming to get through that. But GHPP will pay for a lot of the services or procedures that are needed to keep us healthy. And that process, you know, you can always get assistance with that with the hospital social worker or what have you. So they step in with like medical needs and medical insurance. Financial resources, there's some of everything. Supplemental security insurance, SSI, is something that parents can apply for their children. Once they find out they have a sickle cell diagnosis, there's a way that they can kind of figure out a calculation based on anticipated need. And I'm not well versed in the process, but SSI is a resource for a bucket of, or another bucket of money where you can get some assistance financially. You have scholarships, all kinds of scholarships, whether it be literally for school, college. There's some short-term stipends that are available through different programs. And a lot of the programs you can figure out, there's so many. You can start with a Google search, you can ask social workers, and there's some stuff that's available exclusively to people that have sickle cell disease. So it's just a matter of looking for the information, or at least knowing who to talk to get that information. But a lot of it is available and you can find it online. But yeah, for the most part, I think those are some of the main resources available in California in particular with sickle cell disease patients.
That's good. That's a great answer. Hopefully you guys are all able to get that down right. Make sure you have your pen and paper ready to go. Follow question to that would be, and you mentioned Medi-cal a lot, and we've heard about Medi-cal a ton, but is it really as daunting as sometimes it can be, or
Yes.
is it just very straightforward?
Medi-cal is, it could use a more simplified approach in my opinion. I think with a lot of my clients, what I've seen is that the paperwork itself, just the packet coming in the mail, is very overwhelming. And so a lot of counties have these individuals that will come out and assist with that, called navigators. And the navigators actually will help with the application process, will help you navigate through the system so that you're getting the resources that you need. Again, social workers are there and can assist. There are Medi-cal eligibility workers that can walk you through the process as well. But I think, you know, the packets that go out, because of the volume of paperwork involved, it can be overwhelming, especially if you're already sick and you don't feel well. You're in pain. Like, the last thing you want to deal with is a bunch of paperwork.
Right.
So I would recommend, if you aren't feeling 100% at your best and eager to do paperwork all day, that you get someone to assist with that process. Don't try and do it on your own. And always make copies when you submit anything to the county or any other resource that you're applying for.
That's actually a good point, and I think that's something that sometimes we forget about, is like, we need to make copies on copies, not just for our own personal records, but just in case, you know, because
people lose things.
Lose the paperwork, right? It's
Yes.
like, oh my God, I applied for this like 3 months ago. No, you didn't. You
Right.
never signed the paperwork.
Or you faxed it.
Or you faxed it, right?
Who
Exactly.
uses fax machines?
I know, right? Like, it's such an archaic
Yeah.
way of doing things, but
Right.
but lo and behold, you like, here's the fax number. Like,
Right.
what? So now
Yeah.
you got to go to Kinko's to get the fax done,
Right.
sending it through, and if you didn't make a copy and you sent all that through,
Got to do it all over again.
right, exactly. So, you know, I think that's a very good point, is always be mindful of understanding, like, gotta make copies, even though it's daunting. It's really hard to have all that paper everywhere,
Mhm.
but at least you have it.
Yes.
You know, and whenever you need, you can go refer
Yeah.
to it as well.
I've had my own, you know, package where I've just organized my paperwork. So this is for, I have a Kaiser plan, so I have all my Kaiser paperwork together. And of course, a lot of the health insurance companies have records available electronically, but for my peace of mind, I keep my own stuff in my own files. So, yeah.
So when talking about the navigators and the social workers, and I think you mentioned somebody else, like
Community health workers,
well, you mentioned somebody that actually helps you with the application process. They're what you call them?
the eligibility workers.
Yes, eligibility
Yes.
workers. So are they each their own department, or is it one person that can fulfill all the needs?
No, they're all different roles. So, and an eligibility worker will probably be upset that I kind of threw them in the mix, because they really just work out like the numbers and the details like that to make sure you qualify for a program.
Right.
But they are the ones that go through the paperwork, so they can tell you where they needed more information, or this is too much information, so they can tell you what's needed and what's not needed to expedite the process. So
that's an eligibility work.
yes.
So what's a navigator?
The navigators are, so there's no real educational requirement for the position. These are people that have been trained to get through different healthcare systems.
Okay.
So you find them mostly in county systems, and they just know how to get to the Medi-cal, how to get to, scheduling an appointment for behavioral health, or, they just know how to get things done in each department, so that you're not just going out there trying to figure it out on your own.
Gotcha. So anybody can apply to be a navigator, or are there like hoops that you have to go through? Like, say for example, like I'm your caretaker, and I've been doing all the paperwork for you, and I feel very passionate about it, and I want to go help other people while also making some money. Is that something that I can apply for and get it, or is there like a process to that?
Well, last I knew, it is like a real regular position that you would apply for on the county website. I know it was initially started out as a trial thing, but I believe they kept that position on board. They may change the name over time, so it may not officially be navigator in a year or two. It might be patient care assistant.
Gotcha. Right. Okay. That's cool. That's awesome. That's little things that we don't know about. You always think when you go into this process like you're by yourself, and if you don't know it, you're just screwed.
Yeah, there's so much help out there. Like literally, community health workers, social workers. This is what the job is. It's gathering the resources and helping you get those resources.
So most of the times the problem is that there's just not enough for you out there to get all the information.
That is usually the problem.
Gotcha.
99% of the time, there's not enough of us to help with given the volume of caseloads that we have.
Right. No, that makes sense.
Yeah.
So once you do get into Medi-cal, is there like something that Medi-cal offers for, let's say you sign up under Medi-cal, under Sickle Cell, do they automatically send you emails with all the services available to you? Or?
Not necessarily.
Okay.
And that's one thing that's very shocking for a lot of patients with sickle cell transitioning out of pediatric care into adult care. Pediatrics, like things are, bottled up and packaged and handed to you nicely. Once you get over to the adult side, you're figuring it out on your own, unless you've gone through a transition program. So I know Children's Hospital Oakland, of course they're rebranded UCSF, whatever the old name is. They do have a transitions program for late teens that are transitioning into adult care. So they teach people how to get the services and line up specific doctors that they'll need for the long term for sickle cell healthcare management. So that's a good thing with that, the
Gotcha.
transition program.
Okay. Cool. That's good. Good way to answer that first question.
Yeah.
That was good. That was a good one. Hopefully you guys got all that information. I know it's a lot. But luckily it's on a YouTube channel, so all you have to do is just press pause,
Right.
rewind the tape, and then you can write all those details down. See? Unfortunately for us, we can't do that right now because we're going live.
Right.
Well, we're not live, but you know what I'm saying. Anyway, so great. Thank you for that information, Ylan. That was really good. Again, at the end of this, series, that last episode, we're gonna have a live session on Friday, which we're deciding whether to do it weekly or not. But you can come in and actually email your questions to us. You can text your messages to us. We'll have a number that you can reach us at, and I'll get Ylan the questions as well. And then we could just take it from there, and you could have your questions answered. We're also going to give you an email that you can reach her at in case you had other further questions or any follow-ups you wanted to that. So she'll be available. We'll be available. We'll always be there to answer anything else that we may not cover in this series. But so far, so good, right? I think it's pretty good information.
It's a lot of information.
It is a lot of information. There is a lot. I mean, that's why we broke it up into 6 episodes. You can't just do it all in one.
Yeah,
so.
it would be a lot.
Otherwise, you're going to be sitting there for like 3-4 hours like we are here sitting.
Sleep.
Yeah, sleeping like, oh my God, I can't do this anymore. Like, why are we going? But no, don't worry about that. These episodes will be fun, entertaining, always coming at you. So now, to follow up on that, are the processes, like once you get into it, I know you said that there's a lot of paperwork, but is the paperwork like self-sufficient in the sense that like, put your name, put your age, put your date of birth, like is it pretty, forward and simple? Is it just a lot?
It's pretty straightforward. the volume is a lot depending on the program. Like with the GHPP application, it's pretty straightforward for like 2 pages. It's just your basic information. It's the specific supplemental part of the application that becomes a problem for people. So they need to verify address, so they might want a utility bill, and maybe you don't have those readily available to just mail off or email off with the application. Or they may need proof of income, and maybe you didn't get your statement from the Social Security Administration about your income. So those are the things that tend to hold up the paperwork, because you may not have it available. You have to wait on another agency to send it to you, and hopefully you remember that you were working on this application 2 months ago. So that's the part that is tedious and nerve-wracking. And if you have memory like me, I need reminders. So, if I've started this process with a GHPP application, and I know that I needed to get my PG&E bill and send that over, then, I'll set a reminder for myself on my phone to follow up about that, because it is very tedious.
Right.
Yeah.
Interesting. So in that respect, what are good tools that you can use to kind of remind yourself? One, to remind yourself to do the paperwork, because it seems like it's a long process.
Yes.
Like 2 months, you have to wait for a response, or have to submit paperwork. Like, what do you do to kind of keep your mind on that?
For me, and this is like an interview question too.
Right.
You get 2 for 1.
Yeah, I know.
So you have to use your primary and secondary tools. So I use my cell phone. I set up reminders on my calendar and my cell phone. I also handwrite it out on the calendar on the wall that I have to look at every day to remember, go back and check on this, go back and check on that. Little planners, they have these little cute stickers. I like the arts and crafts things, so I'll put my little sticker reminders in my planner so that I know, this appointment is coming up, or follow up with this paperwork, check in with this person. So there's a bunch of different ways, old and new school, to manage your time and make sure that you're getting your paperwork handled in an effective manner.
That's good. And then in terms of anything else that could come up with the processes, so while you're doing this process, would someone like the navigator be with you step by step? Like, could they be a resource that you can be calling consistently, or are they like a one-time shot thing?
I believe they are consistently available. It's usually just phone, and you have to take the initiative sometimes just to reach out to them. Maybe they're overwhelmed too, so they need a reminder from you that you need help. People aren't mind readers, so but usually, email, text, phone call, and they can step in to assist.
That makes sense.
Yep.
That's good. Anything else in terms of the processes that people should know about that we haven't mentioned just yet? Is any of it electronically available? Like, could you do it online instead of all the paperwork?
A lot of it is transitioning. Because there's so many different like hospital organizations in the Bay Area, for example, some people have things online, or maybe it's just the application that you can print from online, like with GHPP, and they haven't fully transferred the application process to strictly online format. So unfortunately, there's no uniform, way to apply for these services, but yeah, it's all over the place, to be honest.
Gotcha. Nice.
Like,
Okay.
I wish it was all online, but then the issue would be whether or not people have the resources to get online, and if they have internet access. So, all the agencies are trying to accommodate people in all of those ways, so that it is accessible to everyone.
That makes sense.
Yeah.
Interesting. And then within that, is it crazy enough to where, like, so for that program, the GHP that you're talking about, is part of it online, part of it written, part of it like you gotta go in person, like, or is it luckily all just paperwork and that at least you know what you're getting into and that's what it is?
PDF. Last I checked, it's just go online, print it out. At one point, I was helping people with applications, and so I set up like an Excel spreadsheet to auto-populate the fields just to print it out. But setting it up was nerve-wracking. So I don't expect anybody to have to do that, especially if you're just applying for yourself or maybe a couple kids who have, or what have you. But just print out the form, hand write it out, and send it in. The most important thing is to get it in.
Yeah.
Yeah.
I gotta get that.
Yeah.
Gotta do the paperwork. If you don't do the paperwork, don't do the time, you're not gonna get the benefits.
Right.
Right. Instead of thinking
They don't
about
know that
crime,
you
they're
need
gonna do
it.
yeah, exactly. So just think inverse. You know,
Yeah.
like if I did the crime, gotta do the time now. If I do the work, do the time, I'm gonna get the benefits.
Right.
So that's the difference. In this
Absolutely.
scenario, which is a good thing. Again, we're gonna be providing all this information again. It's great that it's on a YouTube channel.
Yeah.
Because all you gotta do is just hit pause, rewind the tape, and be able to write all this stuff
Right.
down. Whereas real live seminars and stuff, like people are like frantically trying to write it down.
Scribble everything down.
You just don't get all the information.
Come back later
know?
trying to read your
And
handwriting.
we could have like a
you
little,
can't.
and we're gonna have like a little. Well, there is a little ticker right now coming up, showing you all the websites that are available to you with the resources that are, within California.
Right.
Also, now that we talk about a state thing, is there like a national program that you can think
There
of?
is. No, I don't want to mess up the name. I know it's like a Sickle Cell Disease Foundation of America, something like. I'm messing up the title of the organization, but they have.
You just
several,
check on the bottom,
Yeah.
scroll it right there. You'll see it pop up. That'll be the
Yeah, the
website,
actual-
their actual name, and
So I
the
don't wanna
website
make it
down
up.
there. Again, right now we're coming off the cuff
Yeah.
right now, so.
So there are national organizations for sickle cell disease, as well as resources through the CDC. So you can go on these websites, and they have all kinds of things, like different resources for financial scholarship and resources, different clinical trials that are going on. If you want to participate in that, maybe there's a financial incentive for that. But these hubs for the entire country have all of this information listed, where you can jump into different parts of what goes on with sickle cell disease as a whole. So whether it's the research, medical programs that are available, financial stuff for school, there's just so much. I keep emphasizing the school stuff because I want people to know, just because you have this disease doesn't mean that you can't pursue higher education, and you definitely have money out there waiting for you.
Yeah, so just because we're talking about California in particular, to our viewers out there that are outside the state, don't feel like we aren't talking to you either. Like, there are definitely resources within your state that you can go find. I mean, there could be navigators, there could be guidance counselors, CHWs out there that you just don't know about. Is there a registry, like maybe like every state has, or nationally, where you could look up certain, like, maybe not navigators, but CHWs?
I believe there is one. They are, I know, like, the community health workers is kind of a newer concept, but there's money that the federal government has been pumping into getting more community health workers into, like, community-based organizations, because, like I said, social workers, they work at the county level, for instance. The caseload is so high. Like, when I was in in-home support services, I had over 500 people on my caseload that I'm supposed to handle within 1 year. So they are trying to divide that work, spread the love, so that people are actually getting the support that they need in a timely manner. So there are different ways to look up, to see who's available in your area. And like, if you're a member of a certain hospital or health plan, they should also have information on their websites that'll tell you about who is available for what specific part of a medical team or what have you. So a lot of the people are doing those interdisciplinary teams in the medical setting. So you do often have social worker, doctor, nurse, mental health components. You have all of that on a team that should be readily available to you with your healthcare provider.
So don't be afraid to ask questions and follow up with them. No question is dumb question, just dumb people. So just make sure you follow that thread in there. So last question with that, and then we'll move on to our next segment, is nationally speaking, like, is there a way that people can contact, because Medicare is a national thing, right? So are there specific, if you go to the Medicare website, or you call someone at Medicare, can they specifically tell you in your state what's available to you, like a Medi-cal type of program? Or?
I know California's is definitely set up that way, so I'm assuming that most states have it set up so that you can see exactly what's covered by state.
Gotcha.
Yeah. So, and you're saying Medicare.
Medicare.
Medicare, this is how I remember, Medicare is for the older people, right?
Okay, gotcha.
But the thing is with so we call it Medi-cal here in California, but it's a Medicaid program.
Gotcha.
But this is why this matters. You have Medi-Medi. where you have both Medicaid and Medicare, and a lot of patients that have sickle cell disease that are experiencing more challenging health issues long term, they do have both health insurance coverages. So they have both buckets of money, which is a great thing because, like I said, with GHPP, you have these procedures that aren't covered by one insurance provider, the other one can cover it. So that's the perk of Medi-Medi.
Gotcha.
Yeah.
And Medi-Medi is on the government website.
It should be, yes.
Okay. So just, again, refer down to the ticker. We would have already found this and put it up there for you guys. Just go ahead and refer to all those websites you see scrolling across. Again, if you don't catch it, just hit that pause button, rewind the tape. It'll be right there. Again, we're going to send out information. If you're curious on in those Friday live meetings that we have, we'll go over all that stuff. Any questions you may have, I'll put it up live so you guys can get that information. Again, if Ylan can join us for 1 or 2 segments of those live stream ones, we'll have her on to answer any questions you may have. Again, we just don't want to cater to just California. We want to make sure that we address any viewer that comes and watches our show. So if you're out there in Georgia, if you're out there in Florida, like, just know you do have resources. You just got to find them. And the problem is, as Ylan just mentioned, that there's just not enough of her to go around. You know, there's not like 30 Ylans in every state ready to help you. There might be 2. You get 2 in Florida. If you're lucky, you got 2 in Florida, and you're like, oh my God, right?
Yeah.
So that's the problem. That's the issue. So if you are passionate, if you're just watching this as an advocate or someone who's curious and you're passionate about this, hey, get involved. Go get your education. This is a good career. It's a good job to have on your shoulders. So that was a good segment, I think.